question is, how do you make sure that you don't get HIV or AIDS?
Okay, good question. Well, I would just refrain. Let's rephrase, not refrain, but let's rephrase the question. What can we do to prevent the transmission of HIV? Well, simply not practicing sex. Okay? And I know that's unrealistic, but realistically, abstinence. That's the only way to ultimately 100% prevent the spread of HIV or any sexually transmitted disease, because we're talking about sexually transmitted disease. You can contract HIV through other means, but we're talking about through sex here. Abstinence. There are other ways where you can reduce the risk. That is using condoms, which I know earlier there was a question, and I'll address condoms. But the condoms, there are two different types of condoms. Do you have something like that before you want to jump in?
Well, you know, that came up in the question, how safe is condom?
Okay.
And is it really, because a lot of people are saying, use a condom, don't worry.
Right.
And then the question I wanted, it came up, and they didn't ask it, but it came up in the meeting that we had, and that is oral sex.
Okay, good. So we have two parts there, that's great. Like I said, we ultimately abstinence, that's 100%. If you're not having sex, you can't contract it, okay? Like I said, there's a disclaimer there that you can contract HIV through other means, but we're just talking about sex here. You can use a condom that will reduce the risk of HIV transmission. Are you 100% protected? Absolutely not. There are two types of condoms. You have latex and then you have natural, and an example would be lambskin. Latex is your best form of protection, best type of condom. It's what we call prophylactic, and I remember, I'll give you a quick little story, and it was pretty funny. During medical school in our first class of pharmacology, our instructor, the doctor, was teaching us about pharmacology and medications, and he started talking about prophylactic. And everyone in the class got really silent. We're talking 210 students, and we all had the same question: is why is this doctor talking about condoms? You know, well, prophylactic. We're not talking about condoms. Prophylactic means to prevent, prevention of. So you see the commercial. Make sure you wear your prophylactic. Well, it's really make sure you wear your condom. We want to use it as a prophylactic to prevent the spread of disease. To prevent contracting disease. So getting back to latex is the best. It's only about 98% effective. It's not 100%. Abstinence is 100%. Then you have lambskin. Lambskin is natural. That is good for sensitivity if you're monogamous with your significant other and you both are tested for all HIV, all sexually transmitted diseases. The reason why it's not as good as latex, it's natural and it has pores. With pores, viruses and other sexually transmitted diseases can be absorbed through the lambskin, and it could be absorbed through the abraded tissue on the penis or into the vagina or the genital area.
I believe Brittany has a question.
Okay.
My question is, can you contract AIDS even when using protection?
All right, good. So we're going to follow up because you're talking about oral. Yes. Like I just said there, there is definitely a risk. You have to, one, know your partner. You need to know yourself. You need to know your status. And we always say, check your status here. We have Bronx Nose, and I've gotten together with Bronx Nose where we're testing, and it's free testing. So check out Bronx Nose. But if you're wearing a condom, it reduces the risk. Make sure you use a latex condom, so that will reduce the risk as well. Abstinence, that's the way to go. It's 100%. Try to avoid lambskin. Lambskin, it will prevent pregnancy, but doesn't prevent the transmission of HIV and other sexually transmitted disease.
You meant oral sex.
Okay, so we're going to address oral sex. I know a lot of the youth today will say, "Oh, well, I'm not having sex, but I'm actively participating in oral." Oral, yes, it's sex. It's just not intercourse. Can you contract HIV? You can. There is a risk. It's low. There's a lot of factors that are involved. The individual that you're having oral sex with, let's say a male, he would have to be positive, and he would have to ejaculate in your mouth. The semen, the ejaculate, would have to be carrying the HIV virus. The individual on the receiving end would have to have an open sore where the virus would be absorbed. The chances of just one-time deal in absorbing and to contract HIV is probably very low. However, the more often you do it and the greater chance and the larger the volume, then you increase the risk for spreading or possibly contracting the virus.
I would like to take this time to really commend my young people for the questions they've asked. They were intelligent questions.
Yes.
They made a lot of sense. And those questions, I know that many teenagers out there watching this program are saying, you know, I appreciate that. So I know we only have about a minute or two left, and I just wanted to thank Tara, Brandon, Nate, Alex, Lala, that's not a real name.
That's fine. That's
and Brittany. I want to commend all of you. You did a great job.
Wait, I have another question, Doctor,
Me
before
too.
we close. Is it true that when a person that has AIDS and then they start bleeding, and then as soon as the AIDS hit the atmosphere, like, does it die?
Yes, all the studies suggest that the HIV virus is fragile, and when exposed to the air, it will collapse and die. Yes. All right. Well, how much time do we have? We have 1 minute. So let me just, we need to close out, but we're going to continue here. Well, I want to thank Bishop Paquette and the youth program for being on the Ask Dr. Tommy O show. This is important. We're filling a void. It's always here, being proactive. Church Live Community Church, #1, always being proactive, being the first at everything we do here. But remember, stay alive with Church Alive. I want to thank Bishop Paquette and the youth. Thank you. God bless.
Thank you very much.
Okay. All right. Now we'll see if we can fit in this last question. What's that?
The question is, what other ways can you get HIV or AIDS besides sex?
Good point. Good question there. Not a point, but good question. You can contract HIV through, we already said, through sex, and that'd be an exchange of bodily fluids such as semen, vaginal fluids, as well as through sharing of needles. So if you're an IV drug user, the sharing of needles, you can spread the virus because you're sharing and spreading blood. Also through tattoos. If you go to like other countries, here in America, we have high standards. The Department of Health are very strict. I want to make sure that the tattoo parlors do have certain standards, certain minimum standards, where you have autoclaves and they have their instruments must be heated so as to prevent the spread of other diseases. But if you go outside our country, they do not have the same standards. They would use the same needles. They would even use the same ink. So there is a risk there associated by going to other countries and getting tattoos. So that's another way.